This patient is a 66-year-old female who presented to my office with an abnormal pap smear suggestive of uterine cancer. I performed a D&C that did indeed confirm the diagnosis of uterine or endometrial cancer. She was going to require a hysterectomy and appropriate surgical staging. Unfortunately, she has multiple medical conditions. She has atrial fibrillation, she has coronary artery disease, she has factor V Leiden requiring anticoagulation, she has poorly controlled diabetes. She went to surgery where I performed an open procedure because of her multiple prior surgeries. She had a hysterectomy with appropriate surgical staging, but she had significant adhesions. We expected a significant amount of adhesions, and she indeed had them. It took an hour to 2 hours to take down all of the adhesions. She did well for 3 days postoperatively, but on the morning of postoperative day number 3, she developed significant nausea and vomiting and pain. It became readily apparent that she was going to need another operation because of an abdominal process that was occurring. I took her back to surgery with the general surgeon, and indeed we found a 2.5 centimeter opening in her small intestine. That opening was not present when I completed her hysterectomy and staging for uterine cancer.
This case involved allegations that Dr. Michelin had actually injured the patient's bowel during the performance of the surgery and failed to detect that injury before he closed the patient, something called an iatrogenic injury or physician-caused injury. These cases can be very difficult to defend, and what I needed to know is if Dr. Michelin was committed to working with me, working with us, to develop a defense to show that he was a very meticulous, careful, caring surgeon, and he brought to bear all of his training, his experience, his surgical knowledge in this case and in regard to his surgical care of this patient.
Having never been sued before and being accused of doing something wrong is very difficult. So it impacts your relationship with your patients, it impacts your relationship with your office staff, with your wife, with your children, with the people in the operating room and in the hospital, and it really impacts all aspects of your life.
From a claims perspective, we wanted Dr. Michelin to be the best witness that he possibly could be, and therefore we wanted him to attend one of our litigation education retreats. In this case, Dr. Michelin has a unique specialty of gynecologic oncology. We needed experts from around the country to help support his case and to present the allegations of this case to the jury.
Dr. Michelin was engaged in this case right from the start. Even at the time of our initial meeting, he was going through the medical records with me, reviewing the allegations in the complaint, helping me understand the nature of the claims, and then Dr. Michelin actually traveled out of state with me to the deposition of the plaintiff's expert and helped me develop a strong cross-examination of that expert that we were able to successfully use at the time of trial to defend this case. The outcome of this case was one of great success. Dr. Michelin was completely exonerated by a jury after maybe 40 minutes of deliberation. I had a chance to talk to a couple of the jurors afterward, and they were very impressed with Dr. Michelin.
I was thrilled that the doctor's company was my malpractice insurance company. They engaged me right from the beginning, sitting down with the case manager and sitting down with my attorney. We formulated expert witness list. They listened to me, they were objective, they pointed out strengths and weaknesses, and really allowed me to participate in my best defense.